Welcome back, you guys, or welcome back, me. How you guys out there in social media land doing? I hope good and everything. Hopefully, you can carve about an hour and 15 minutes out of your time to learn about your GI system, the gastrointestinal system, or the gut and everything and stuff. That's what I'm going to be talking about tonight. And so, welcome on in to Medical Talk in Layman's Terms with Nurse Charlene. And yeah, I'm Nurse Charlene. Okay, so welcome on in, you guys and stuff. You know how I like you to hype me up and everything. So y'all get ready and stuff, and start sending me some questions, some experiences. I take it all. I enjoy it all and everything, and let's go from there. Um, yes. So, like I said, tonight's topic is the gut. Oh yeah, that's good. Um, yeah, the gut, and I'm gonna be talking about your food and poop tubes and stuff. So you see my little board behind me and stuff is got a little person. I don't know who that is yet, but it got a little person and stuff, and then it kind of shows you where everything goes and stuff. You see how I'm getting really dynamic with my drawings. Okay, they cartoonish, but they still get the job done and everything. And I'm going to show you something that I know about until several years ago, and that is the Bristol chart. It's a chart that tracks your dookie, poo poo, whatever you want, bowel movement, and everything, your waist and everything. And that would be this over here. And they have types. If you got little hard, crunchy balls and stuff like that, that would mean that you probably are, if they're little rocks and stuff, and you know what that is and stuff, because everybody has had each and every one of them, or just about all of them and stuff. So it's really going to be dynamic. So before I dive on in, I'm going to read my podcast disclaimer and everything. You guys, welcome on in. Miss Sandra and T, thank you, ladies, for coming on. And Miss Mary, Nurse Mary, thank you for coming on tonight and everything. The topic is the gut, the GI system, the gastrointestinal system. Gastro meaning stomach, and intestines is a part of the stomach. It's the stomach, and then it's the next processing center of the GI system or gastrointestinal system. It's where you eat and where it go after it go inside of you. It's McDonald's when you see it and you bite into that Big Mac, then it goes down in somewhere and stuff. That's what I'm going to be talking about and everything. So welcome on in. Miss Sandra said, my first comment. Good evening, Nurse Charlene, Rosie, and Brittany. Yeah, my other little fellow nurses is here and everything. Yes, thank you for that, Miss Sandra. And Miss Mary, she said, hello, everybody and stuff. Hello to you. Good evening. So I'm going to be talking about some good stuff. Oh, also, you said from T also. Thank you, T, for joining on in and everything. And I'm going to do something to surprise you because guess what? Your body is a snitch. Believe it. So when I say that and stuff, I'm talking about me too. Yeah, mine be snitching. I can't stand it, and everything and stuff. Welcome on in, Auntie Josie. She said, hello, everyone. Glad to be here again. Hope everyone is having a beautiful and blessed day. And we hope you're having the same. Thank you very much. And Cousin Maria, hey, she said, hey, cousin. And she came on in. Thank you so much. We're talking about the gut and stuff. So in the mouth, out the butt. Yeah, that sounds... Okay, it rhymed though and stuff, but yeah, you know what I'm talking about and stuff. Welcome on in, you guys and stuff. Hello, welcome on in, Miss Kathy. Thank you for coming on and everything. I'll be on here about an hour and 15 minutes, give or take and stuff, but just enjoy whatever you can and stuff. And if you got to get off and stuff, I understand it's other meetings and stuff like that, and that's totally fine. But yeah, you don't want to miss this good stuff. I even took my time and drew the whole GI system and everything because I'm trying to give you a treat here and me. Yeah, I get a treat when I do it too and stuff. So yeah, so let me go ahead and read the podcast disclaimer. And Miss Kathy said, "Hi everyone." So welcome on in, everybody, and stuff. And it goes as follows. Welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. This podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Okay. Every person is different. Yes. And what works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, medications, or lifestyle. Don't just depend on anything, not just my podcast, but anybody's podcast, and unless you know that this is something that you really can do. Okay. If you think you may have a medical emergency, call 911. Or like they say on the doctors, when you call the doctor to get an appointment, if this is a life-threatening emergency, hang up and call 911. Call the popo, call somebody and everything, and seek immediate medical help, attention. The views shared on this podcast are based on professional experience and general medical knowledge presented in layman's terms, keeping it simple, to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. No provider-patient relationship is established, and you are responsible for your own health decisions. You are responsible, and that's the way you want it. You want to keep it that way. And remember, your body speaks. Your body's a snitch. Believe it. Listen to it. Respect it. And when in doubt, check it out with a medical professional. Thank you for tuning in and taking a step towards better understanding of your health. Okay? For me too, because I'll be reading it to me and stuff. So I got to go ahead and let you guys know I was being bad and stuff. And I was like, I like my face the way I like it and stuff. But okay, I'm going to go ahead and give it to you guys. Yep, I can't see. So I gotta put glasses on and stuff. Don't say nothing. I don't want to hear nothing about the glasses until we at the end of the podcast and everything. But I can't see. So I'm gonna go ahead and get on down now and stuff. It's the gastrointestinal system because your body is a snitch. And what is the what is the gut? What is the GI system? What is all of this about and everything? Okay. The gastrointestinal system, also called the digestive system, is the body's food processing plant. It takes the food and drinks that we eat and drink and consume and breaks them down into nutrients, energy, and it absorbs what the body needs and removes the waste. Just as simple as that. You put the McDonald's in there. Thank you, Auntie Josie said your glasses look great on you. Love it. Thank you so much and stuff. Because I'm going to have to start wearing them, you guys. Yep, I got to get on down and stuff. I'm getting so young that I need glasses now and stuff. So we'll see. And she said, oh, yeah. I knew what you were saying, Auntie. She said, I mean, you say they look great. Thank you so much. I appreciate you and stuff. So the GI tract, what does it include? Right here, right? So I'm going to say it. It starts with your mouth. And actually, if I got into real big details and stuff, it start with your mouth and your teeth and your tongue. They all play a role in getting the food in. You see the food. I'm about to get down. I'm hungry, and stuff. So guess what? Your stomach already started, we call it growling or something like that, when it start making sounds and stuff. And you like, oh, dang, shut up, and stuff like that. You punching your stomach like, don't do that. Don't do that right now. You player hating. But anyway, I'm saying that to say that sometimes your stomach do it, or you just know it's time to eat, period, and stuff. This is what I should do and stuff. So that's where it starts, at the mouth. And welcome on in, Rosie Granny Allen. She said she's watching in Jesus' name. Amen. Thank you and amen. I love you. Yes. Amen. And stuff. So the GI tract, or our whole digestive system, includes this mouth with, of course, teeth and tongue. And you put the food in, it goes to the back of your throat after you chew it up the best you can and stuff. And then it goes to the back of the throat and it drops down into a food tube called the esophagus. Okay. And so that esophagus, it mashes the food down, and kind of pushes it down. You might have to drink some liquid and stuff, and that might push it down. They say don't do that, but we do it anyway and stuff. So what? And stuff. However you get it down, it goes down. And then guess where it got to drop into? The stomach. So it goes in your mouth, to the back of your throat, drops down into your food tube called the esophagus. And then from the esophagus, it drops down into the stomach. The stomach has acid in there. That's why you have to have Pepsid and all of these things and stuff, because the stomach is breaking the food down even further. And so then after it breaks it down, it's a few more characters. They don't get named tonight and stuff because I'll be here forever. But it goes into your small intestine. You have a small and a large and stuff. It goes into the small first. And so as it moves around in the small intestine and does its thing and stuff, it pushes it along into the large intestine. That is the large intestine, also known as the colon and everything. And so now it's moving around in there and stuff because it got to get ready to do something. So it's in the large intestines or colon and stuff. Then it makes its way to your rectum. There's a such thing as rectum. It's your butt, your butt tubes. But anyway, your rectum, and then it comes out of your anus, booty, anus, booty, anus. Okay, and stuff. So that's what a human being does. And there's some cases, where something is wrong and stuff like that, and that I might be able to talk about tonight and stuff. But there's other abnormalities and stuff like that. So it's not just black and white here and stuff like that. But for the most part, a healthy or semi-healthy person, that's the way it comes out, or that's the way we view it. Okay, so other organs that help in the digestion, so don't sleep on them, is your liver. Your liver is the filter and everything, so it needs to be in working order or there's a problem. Also, there's a gallbladder. And you heard of getting your gallstones and stuff like that and stuff. So there's the gallbladder. And then there's also one called the pancreas. And the pancreas, it actually has certain hormones it secretes and stuff like that, like insulin, your own human insulin and everything. Now, if something goes wrong where we're talking about diabetes, that means there's an attack on that system. It's not putting out good insulin that can help your body. And so therefore we end up coming into pre-diabetes, diabetes, and so on and so forth. So that's where that comes. So just a quote: when the GI system is unhealthy, the body often sends warning signs early. It's going to tell you, you messing up a little bit, so you want to correct that. Like, what you going to do? And stuff. So it'll try to tell on you and stuff. So I'm gonna save some of the quotes until after I get through some of the things that I want to explain to you. The main functions of the gut or the GI system or the gastrointestinal system, are these. One is digestion. And that means it breaks food into smaller pieces. That we needed to do that and stuff. That's right. And stuff. So it breaks the food down into smaller pieces, and that's digestion. Then there's one called absorption. Like a paper towel. You put the paper towel on something wet and it's supposed to absorb the water into the paper towel. Well, this is the paper towel of your body and stuff, is the absorption. This is what it does. So inside those intestines that I was telling you, small intestines and everything, then it goes to the larger intestines. It pulls the nutrients, your vitamins, and your food. That's why they want you to eat healthy, because carrots got a vitamin in there. Greens got a vitamin and stuff in there, and minerals in there and stuff. And things that you eat have that in there and stuff. So it pulls the nutrients, vitamins, water. That's why they tell you to hydrate, because it actually uses the water, believe it or not, and minerals into your bloodstream, so that your blood is flowing properly, not all thick with sugar, or not all thick, thick with salt even, and stuff like that. So that's why we're supposed to eat healthy. I didn't say I ate healthy all the time and stuff, but I know what I'm supposed to do. And if I do it wrong, then I pay for it like anybody else. Okay. Then the number 3 of the main functions of the GI system would be waste removal. Dookie is dookie and stuff. It removes toxins and waste through bowel movements, poo-pooing, okay, and stuff. So that's what waste removal is. And then immune protection. So you got a whole immune little area and stuff, for getting sick with colds and everything. And if your gut is sick, the whole body can be sick. So we got to keep it going and stuff. So the immune protection is a large portion of your immune system lives in the gut. So it wants to protect protect you, even your gut. Okay. And then last but not least, hormone and mood support. The gut helps produce chemicals like serotonin that affects your mood and emotions. If you sad or happy and stuff, do you know if it didn't secrete these hormones and stuff, then you can just be all the way depressed or all the way happy and stuff. But whatever it is, it's supporting that and stuff in your gut, not in your brain. Like, I'll be thinking sad, so I'm sad, or something. Like, no, your actual gut is the second brain body, and everything. You got the brain up here that supports us, but you also got one in your gut, and they got to be healthy or we in trouble. I didn't say you in trouble. I said we in trouble. We human beings. We got a butt and a mouth and, things, stomachs and stuff like that. So just trying to make it kind of clear. Okay. So then we got common GI illnesses, or common gastrointestinal illnesses that we find and stuff. One of the biggest culprits is this one called GERD. Has anybody heard of it? Okay. And stuff. So GERD, it happens when the stomach acid flows backwards into the esophagus, your food tube, causing heartburn and irritation. Now, let me tell you a quick thing about that. You eating, right? And so you chew up your food. Once you chew up your food, you kind of bring it to the back and swallow it. Now it's in your throat. And so it has to go somewhere. So it ain't going to go in your windpipe unless you choke to death or something like that and stuff. So it's going to go inside that tube called the esophagus. That's your food tube. Nothing but food and drink go in there that you consume, that you drink, that you eat and everything. Rosie Granny Allen talking about, yep, that's right and stuff. So so your food goes in there, right? So once you swallow it and it goes to the back of your throat, it got to drop into that food tube. So it opens up. It's a flapper. If I start talking about epiglottis, it's just too much. But it's a flapper. It opens up and covers the air tube, because your air tube is right next to it. That's why we choke half to death when something go in the wrong pipe, we call it, and stuff. So it opens up and then it shuts behind it. So nothing comes back up, and stuff. And then it dances and gets down and stuff. And it's only a little short tube right here. And then it drops down into your stomach. Your stomach has chemicals like acid in there. It's pure acid and stuff. That acid is supposed to break down whatever you drop in there, whether it's a Twinkie or it's a big old broccoli, that you just ate or something like that. It doesn't matter which one it is. It drops it in there because your body is going to search for anything out of anything. It's going to go for the ho-ho. It's going to go for the ice cream. It's going to go for all these things and stuff. So when it drops down into your stomach, it's supposed to stay there and then pass on from the stomach. It passes it on into your intestine. But guess what? When you get GERD, gastroesophageal reflux disease, that second, so one is at the top and it pushes the food down, and then the food dances and it drops down into your stomach. It has a flapper down at the bottom too, and it opens up, lets the food drop in, then it closes. Guess what happens? Over time, if we have too acidic or something like that and stuff, it starts eating away at our little door that's supposed to close and keep the food down there. So what it do? You go in there and you eat real good and stuff, get real full, and then you go lay down somewhere. And guess what? That bottom one, it open up a little bit and be like, yeah, get some of this and stuff. And that acid from the stomach that you don't want inside your food tube, it comes back up. And so there's where they call it the heartburn, the indigestion. It's not digested. It's coming back up into your food tube. It only want McDonald's or whatever you're going to eat or something like that in there. It don't want no acid in there because it burns it all the way up. It's acid. And that door is supposed to stay closed, but over time and what we drink and what we eat and, our lifestyles, it melts away at it and stuff. So now it's a weak door. So sometimes it'd be like, I'll just open for a second. I'll open. You know what I'm saying? And it do that and stuff. And it's bad, but that's what it does. Now, what they said about GERD, and the reason why I'm talking about this, because guess who? Okay. But anyway, I'm saying this to say that some of the risk and causes of it is being obese. So that means you already stretching your stomach out anyway, because you're eating a lot. You're not just eating one helping of food or eating until you're comfortable. You're eating until you make sure that it doesn't, your stomach doesn't growl and all of that type of stuff and everything, which is a whole other system, and stuff. But I'm saying, so obesity is one, smoking is one. So smoking cessation. Anytime you can, if you are a smoker, no, this is not triggered or against any smokers. This is saying it's time to slow down. It's time to, be aware of it and stuff, because it can be a problem. It's going to cause a problem. Pregnancy, your gastroesophageal. So you burning and you got a big old stomach with a little baby in there, and stuff like that. Spicy foods. Now there's different cultures that it's just a rite of passage, to have hot foods and hot and spicy foods and stuff, way past that Crystal's hot sauce or something like that, but more Tabasco saucy and, different things and stuff. They do something, just you gonna faith around and find out and everything. So spicy foods, fried foods, they can give you the business too. They can cause problems. Fried foods all the time. That's why the doctor's always trying to tell you this stuff. Well, I can't eat nothing. I know, because all of it, everything we eat got something wrong in it. Did you see where it was processed? That chicken? Did you see where this was processed? That fish, that so-and-so, that such and such? Yeah. So yeah, it's going to be a problem and stuff. It's chemicals. It's chemicals in the oil that we eat. Did that stop me from eating it? No, probably not, but it slowed me down. where it's not as appealing once my stomach start hurting and I have problems. I got to sit up here and figure out how to make it go away, and stuff. Then yeah. So then, it's the greater of two goods. You can eat and it tastes good and stuff, but remember, you might have to pay for it. So just remember, as long as you okay with paying for it, eat, and stuff, okay? And then there's alcohol. I know, blame it on the alcohol. No, it's just like cigarettes, alcohol. So I'm not going off on anybody about that. But if you taking down jugs of alcohol, you're gonna probably faith around and find out, and stuff. Just be like, oh, every time I drink, I wonder why I fall up under the toilet and be in between the bathtub and the toilet or something, and so, yeah. It causes other problems, but I'm saying it causes that too, and stuff. And then eating late at night. But I'm watching a good movie and stuff. I can't have my ice cream and got me a few chips here, fried chips. And then I got me a little this and that and stuff. And then you go to sleep and you wake up and you might be constipated or have diarrhea or be bubbling and bubble guts. Or I'm just saying and stuff. So symptoms that you might have: GERD. I ain't gonna say that whole big old word again. And that would be your heartburn, a sour taste in your mouth. That means the acid that made it through 2 doors and made it back up to your tongue, where you could taste it. It's kind of throw up-y, but it's acid. And that bile and stuff like, oh my God, it's a terrible thing, and stuff. Burping. If you got to burp 15 times in a row, and stuff like that, something might be wrong and stuff like that. It's something you eating and stuff. I didn't say that I didn't burp before or something like that. I'm just saying. Chest discomfort, you always burning right there in the middle, my heart burning and stuff. They call it heartburn, but your heart is usually on your left side, unless, some people are different and they're born with it right in the middle and stuff like that, some weird stuff. But anyway, yeah, so you call it heartburn because it's right like center mass in your heart, in that area. Then you got trouble swallowing because it's all sore and interrupted because of the food or because you didn't threw up, and stuff like that and stuff. So over time, all that stuff coming from your belly, it's supposed to stay in your belly. If it comes up that tube, that food tube, and then into your mouth and then out into the toilet or whatever and stuff, if you make it and stuff, that's a problem and everything. So it could give you chronic coughing, and stuff, always coughing and stuff, but it's really just irritated. It's inflamed and it's a problem. The treatments they got for it, and this is GERD, gastroesophageal reflux disease, okay, and stuff. It's antacids. That would be your Tums. That would be some like a Malox, I think, or some, or Mylanta, one of those little creamy things to kind of coat the stomach a little bit. Acid reducers like Pepsid and Pepto-Bismol, and thank you, nurse. Weight loss, that's another one. Everybody wants you, if you got pre-diabetes, lose some weight and it'll go away, pretty much and stuff. If you got this, that, or the other and stuff, they always say just lose the weight and stuff. That's your biggest treatment for everything. Avoid trigger foods. Yeah, if you can't handle the jalapenos or whatever stuff, get away from them. You can eat without that. That ain't, it can't, your life or that, and stuff like that. So you got to figure it out and everything. And then there's elevating your head while sleeping. Do you know that you don't need to be flat like a dead body? You got to have a pillow up or something and stuff. You got to elevate that, because if that food ain't digested, say you didn't just go to bed right after you ate, but you stayed up and moved around, cleaned up or something like that and stuff like, and then it's time for bed and you might still be full in your stomach and everything, which is good, I guess, and stuff. Then you lay down flat and guess what? Them flappers just open. They be like, yep, they want to lay like this and stuff. I'm going to let all this stuff run from my stomach all the way up through the food tube, all the way into my throat, and possibly cause them to throw up in their mouth. If they too lazy to go to the bathroom and throw it up or something like that. I mean, it could happen. And then another one is stop smoking. Okay. So your body is a snitch. They got a quote. Heartburn after every meal is not normal. Your body's snitching. It's telling. Come on, let's go and stuff. So that's just that one. And then instead of me going through a whole bunch of them and stuff, I'm just gonna hit the ones that I know people have been going through and stuff. And that one was the GERD and stuff. Everybody got that when they take Protonics, Pepsid, what is that other one? Alka-Seltzer, all types of stuff like that. But that's the reason for it. You trying to get rid of the reduce the acid. It's too much acid. So the stomach needs acid to break down food, but we don't need the acid to burn through our little flappers that keep us protected, and then it go up into our food tube and burn our food tube. So it's a problem, and stuff. It's big time. Oh yes, Miss Sandra, you said what? It sounds like almost anything you eat too much of causes gut problems. Well, I'm just going to say it. I was taking a leave which caused stomach problems and exactly. So she said she was taking a leave that caused stomach problems and kidney problems and stuff. Yes, because we got to watch out. Tylenol, Pepsid, Pepto-Bismol, Alka-Seltzer, all these things and stuff. Remember, they're not the cure for what's happening to you and stuff. They reduce symptoms. If you got a cold, you take some Robitussin. Robitussin doesn't heal you. Robitussin stops you from probably coughing so you can get some sleep instead of coughing all night and not getting your sleep. You see what I'm saying? It's a Band-Aid, and that's it. It doesn't heal the scar under the Band-Aid. It only tries to fix what you took it for. If you took it because I got a headache, well, that headache could be high blood pressure. But just because you take a Tylenol and your headache goes away, that doesn't mean your high blood pressure went away. Only your headache went away. So now your head isn't hurt. But why was it hurting in the first place? That's what we got to get out of. Because guess who used to do that all the time? If somebody asks me, oh, if I got this and then put some hydrocortisone on it, put some so-and-so on it, and then I have to kind of stop myself. Go to your doctor and tell them that you didn't have this rash for 2 weeks. Yeah, you can't come to me and then be like, it didn't even work. Oh, and I'm your doctor. You know what I'm saying? So just remember, all medicines are not healers. They're Band-Aids, just about and everything. So that's the problem. And it's our behaviors. And nobody is wrong for eating, late at night or early in the morning or drinking in the morning or something like that, because it's also a whole bunch of other things that causes these problems and everything. So Auntie Josie, you said, I snack at night because I'm up late, and last night I threw up a little bit. Oh, you always talking about things that seem to happen to me or my family members. I love it. Very educational. Thank you, Josie. You know what? I get a lot of the stuff from me and stuff, but a lot of the stuff that I think about from, me, the main patient, but also from my, the people I take care of and stuff, and the people I look out for and stuff. And so that does tend to happen a lot. Oh, Miss Sandra said, thank you for that information. Yes, Miss Sandra. So this is not against you or anything like that. What I'm trying to say is all medicine, we all guilty of it. We take this because this is wrong. I'm eating on Hall's cough drops because I got a cough. Why do you got a cough all of a sudden? Or did you always have a cough every single year, every single day? You see what I'm saying? They're Band-Aids. They're not the cure. They're not the fix, and stuff. It's other problems. And that's why I said it's your body snitching, because a snitch is a symptom. So if you coughing and you got a fever, I got a fever, it's 102 and stuff like that, you take some Tylenol. Or that's what you think, and stuff. Before you go to the hospital, I'm going to the hospital. No, I'll take some Tylenol. I don't want to sit in there with other sick people so I can get sicker than my sick, plus they're sick, and stuff like that. So we tend to try to fix it at home. I'm guilty of it, and everything and stuff. We try to fix it. And we wasn't wrong for it. What is that? Pepto-Bismol. Now you got heartburn, digestion, something, diarrhea or something like that and stuff. Yeah, they naming off all of them, but did they say they cure it? No, they might stop your diarrhea, or it might stop that indigestion, or it might stop that heartburn and stuff like that, but it's not the cure. It's a Band-Aid. And once you peel a Band-Aid off, that scab is still there. How did the scab get there? Because this happened over and over, and it worked for you. That Robitussin worked. That Pepto-Bismol worked. That Pepcid worked. That Aleve worked. That Tylenol worked. That Motrin worked, and stuff like that. And so that's what we do. We're going to keep on trying to fix it. Well, what we solved it or something like that and stuff. So it makes sense. Cousin Maria, thank you for that. She said, we do this without finding out what the root cause is. Now, this is the good part about that. Okay, say this is wrong with me. Once I find out that I got high blood pressure, period, and stuff, then when I take a Tylenol, I'm not masking the high blood pressure, because it didn't fix the high blood pressure. I'm going to get a headache again. And then I'm going to take some Tylenol again. And I'm going to take some Tylenol again, and stuff. I'm just saying and stuff. So we're only touching. Oh, yes. Maria said, what's the root of all the symptoms, or what's the root of all the snitching? What really is going on there? Once we start finding out why, what's happening and stuff to us and stuff, then we can go after that. And if you have to stay on some blood pressure pills just for a short period of time, guess what? Train your body while you're on the medicine. Train your body while you're on the medicine and stuff, and then you can get off. You don't have to be on there forever. Even if they said that and stuff, get a second opinion, a third opinion, a fourth. You got your rights, and everything. But what I'm saying is, through all of this, our biggest disservice to our body is us. If it's bleeding, I'm going to put a Band-Aid. Or I'm going to apply pressure and put a Band-Aid. If it's hurting, I'm going to take some Tylenol. I'm going to take some Aleve. I'm going to take some this and that. Remember, they might help with this and give you this. They help with that and give you this, and stuff, and so on and so forth. So that's why you're on, somebody is on 3 or 4 blood pressure medicines, or they're on 2 different kinds of diabetic medicine, some insulin and some metformin, or they might be on metformin and they have to have a diet change and stuff like that, because you get on this medicine, it's already a chemical changing up your DNA. Everybody worried about the vaccines, by the way. What is it? Shingles, Tdap, and one arm yesterday. I started not to come on today. Ooh, it hurts. Ooh, somebody shot me. And then one shingles and that. Oh, and the hepatitis B. It's called the healthcare workers shot and stuff. And it's 2 shots and stuff. I got to go back in, I think, a month or something like that and get the second dose and everything. But guess what? It didn't feel good to me, and I'm a nurse that gives out shots. Yeah, it didn't feel good. And last night I thought I was going crazy and stuff in there. I thought I was like, y'all, and they wanted to give me a COVID shot too. I was like, no, y'all don't get to kill me today. and stuff. You could give me a couple and then I'll come back for some more and stuff, but you ain't gonna just hit me up, all at once and stuff. But that's what I was saying about the vaccines and stuff. Yeah, they don't cause you to grow a tail. They don't cause all of this stuff. But what if Pepsi do? What if Tylenol does? What if does, and stuff like that. So at the same time, you just got to be careful and everything. Oh gosh. What is this? Oh, okay. Never mind. But anyway, I want to go ahead and I'm just going to name some honorable mentions, and then I'll stop at the ones that I want to give you guys, because this is really, really important. It's your gut. It's all about your gut, your stomach and your butt, your mouth, your stomach, your butt, your gut and stuff. So there's a thing called peptic ulcer disease, and that's an open sore in the stomach or upper intestines, your small intestines and stuff like that. And it's really bad and stuff, but I'm just giving that one an honorable mention and everything. But it has a lot of things. I'll give the symptoms: burning stomach pain, nausea, vomiting, dark stools. Dark stools means it's blood. You've been bleeding and then it dried up and then you bled again and stuff. So if you got black dookie, it's bad. Yeah, you better get it checked. You got to. And so that's why they be sending out them little cards and stuff every year. They want you to put your little dookie on the card and stuff, and then mail it back, and it'd be like, I'm guilty of being bad about that. But guess what? Who was it gonna save? Not they it was gonna save me in my life, and stuff. So guess what? If you got to drop off a little poop on the card, do it. Stop playing. You do worse things than that to yourself and stuff. You could drop a little dookie on the card, let somebody else process it and everything and stuff. That's okay. There's another one called gastritis. Gastro means stomach. Itis means inflammation. Stomach inflammation, gastritis. Okay. And the definition of it is inflammation of the stomach lining. We need our stomach not to be, it already got acid in it inside the stomach for breaking down food. And then you got inflammation of it. That means that it's going to start breaking down inside your stomach, lining, and it's going to burn a hole through it because that's a weak spot. Welcome on in, cousin Tony. Thank you. She said, hey, cuz, I'm here. Yeah, let's go. We're talking about the gut, the GI system. Come on, let's go. Okay. And so, so the gastritis is the inflammation of your stomach lining. It's on fire. And it shouldn't be on fire because it already got fire there. It got acid there. So the acid sees that inflammation spot, and guess what it's going to do? Attack it and burn through it. That's a weakness. It's going to burn right through that. So it's a problem and everything. Then you got just the honorable mention. I don't know if I want the honorable. We'll see and stuff. I might go back and visit it and stuff. It's irritable bowel syndrome, IBS. I know y'all seen a commercial on and everything and stuff like that, but that's the real deal and stuff. And that one is a chronic disorder affecting your bowel habits without visible damage, meaning your bowel is your colon and all of that, your poop tract, and stuff like that. If it gets inflamed and stuff, it starts doing stuff to your dookie, your poop, your stool. If you don't know what stool is, dookie, poop. Okay, so I'm in layman's terms, so you guys got to understand and stuff. Nurses and medical people and stuff, you guys already know, but I'm saying as far as anybody that doesn't know exactly what that is, like why she got them little snakes in the plane and stuff like that and stuff, that it really means something and everything. So types of irritable bowel syndrome is one is with constipation. That means you can't dookie at all. It's just stuck up in there and you like, oh, my stomach hurt, but it ain't gonna come out. And one little rock came out and I sat there 15 minutes on the toilet and a little rock came out, or it's a little turd, but it's a little one, and stuff like that. That's where that comes from. Or diarrhea. If nobody knows about diarrhea, you must be perfect. You got to be. Because I didn't sat on the toilet and found out, faith around and found out that it's liquid. And it almost sounds like you're urinating or peeing and stuff, but it's coming out your butt, and stuff. Yeah, it's not supposed to do that. You're supposed to have a friendly turd somewhere up in there and stuff. And if you don't, that's a problem and everything. So causes of irritable bowel syndrome. I'm gonna go ahead and do this one, and that is stress, anxiety, certain foods, and your gut can be sensitive. It can be emotional. I don't want that, or what. I don't know. But I'm just saying, it says things, like, what, I don't want that. That's nasty, or stuff like that. Why you eating this? Why you eating so late? You fat, or whatever your body says and stuff. So that's where that comes from. And then the other things that it'll do is it'll cause cramping, it'll cause gas, farting, flatulence, whichever one you pick up. The big what my daughter said, Brittany said, step on the duck. So like, where you get step on the duck from? A fart. Okay, and stuff. Then you got diarrhea, constipation, and bloating. And the treatment for it, okay, I need to tell you guys this because you could have had it at any time and stuff, but that would be fiber. They don't be playing around with that fiber. You got to get it in. Who dealing with that? Darn it. Okay. But I'm saying fiber, stress management. Who dealing with stress? Oh, I know y'all perfect. I deal with stress. Yeah, I'm admitted and stuff. Y'all probably ain't never had no stress and stuff. It's okay and stuff to be like that and stuff. But yeah, I had to deal with stress management of my own self, put myself in check. Hydration. Oh, I know y'all drink your 8 to 25 glasses of water and stuff. Yeah, I had a little problem with that. I had to start putting things in there, and stuff. So I'm just saying, diet changes and stuff like that. So, that's a problem and stuff. Because Tony said, and some medication causes absolutely. Norco, Percocet, Tylenol coatings, what else can you have? Morphine, all of them, Dilaudid. They all cause some type of constipation. The doctors don't want to give it to you, and they are getting watched. They have a whole watch system over the doctors that prescribe these pain medicines and stuff. Unless you have a real diagnosis that means that you need that and stuff. Other than that, they only gonna give you a few, and then don't ask for no more. You might as well go on one of these street corners and get you a little something. You ain't guaranteed to get the right thing either, and stuff. How you gonna trust them and they don't even know where they got it from and stuff? So that too. And then cousin Maria said, me too. Yeah. So all of these things, they just make so much sense. And you said fiber is so important for our gut. Absolutely. And guess what we do? Stay away from fiber. Why? Why do I have to eat that apple and chew the skin too? I just be chewing for nothing, like dry bubble gum or something like that. No, that apple and that skin, it gets down, it hits hard and stuff. But I'm saying, that to say that that's what's going on and stuff. And I'm the one peel my apple and then I'll dip it in some. But yes, I need the whole apple with the skin. And if we teach the kids to eat the apple with the skin, guess what? They don't have constipation either. And they get a nice sweet apple. So it's almost like they get a little treat, and stuff. Instead of Takis and flaming hot cheddar, Cheetos and all this other stuff. Yeah, they give them a hot mess and they be on the toilet just as long as you do with a newspaper. And they only 3 or 4 years old. Exactly. And stuff. Stress can upset your stomach before it upsets your schedule. Ooh, that's kind of powerful, huh? Stress can upset your stomach before it upsets your schedule. Before it jack up your whole day, it could jack your stomach up, and then you already in trouble. You already on losing end. Yes. Oh my God. And stuff. And so it's another one called IBD, inflammatory bowel disease, inflammation of your bowel. And that one includes some things like Crohn's disease, if you've ever heard of it mentioned. And it doesn't have to be you just because you're on here. You're lucky to be on here to get this information. You can save your family's life. That's the big deal. You know, you can save your family's life. And so there's Crohn's disease, and there's one called ulcerative colitis. The colon colitis, inflammation of the colon, but ulcer is that's when it's a sore inside the lining of something, like your colon, your large intestine. It's a problem. It's an absolute problem. And you start having that, then next thing you know, you pooping out, and you finally getting you a little smooth groove with your poop, and it come out with some blood on it, you know, and stuff like that. It could be, we said, right now blood will be high red blood, bright red blood and stuff. If it's old blood, that's when you get your black blood, but that means it's bleeding and then it's stopping itself, and then it's bleeding, then it's stopping itself. So it is a problem and stuff. Maria said, what? Fiber is beans, rolled oats, chia seeds, and lentils. Yep, those sound delicious. I know Maria gonna have to come cook some of that for me at my house and stuff, so she can make me like a lot of that stuff, because we absolutely need it. And nothing's wrong with some red beans, you know, and stuff. You know, nothing's wrong with chia seeds inside water, or you could put it inside a certain drink and stuff, and you get that chia seeds inside of there, that rolled oats and stuff. That's the special, you know, like I'm not sure. Maria, tell me if Quaker Oats is a good brand, or do you need the steel cut or something like that? But tell me about the oatmeal and stuff, and the and everything. Oh, she said you need 25 grams daily. Who raise your hand if you get 25 grams daily of fiber? Shame on you. But who didn't raise their hand? But anyway, I'm saying, so although I laugh and try to keep it kind of humorous, so it don't be boring and stuff like that, is this serious? It's 911 serious. Because you don't want to be caught up having diarrhea, because diarrhea can wipe you out, all your electrolytes and everything. Next thing you know, you got low magnesium, low potassium, low this, and then guess what? That heart don't want to beat right. And then next thing you know, you setting yourself up for a heart attack and all of this stuff. So we got to keep some clean guts. And the only thing that we're surviving off of is our instincts to know that this time I need to make this, and I need to make sure that I'm taking this, and I need to make sure that I'm taking my supplements. I know that I don't eat enough of this and eat enough of that and everything. And there's some good supplements out that I'm going to come back on with my son and stuff. And we're going to talk about these with you guys and stuff, of the supplements, like the gut primers and stuff like that and stuff, so that you get a whole little feel of what it is, because we got to get our gut right. Because if our gut ain't right, our way of thinking, our emotions ain't even right, because that's your second brain, is in your digestive system. Yes. And cousin Tony said diarrhea also causes dehydration. Absolutely, because guess what? What's coming out of your butt? Liquid. So if it's liquid and then it didn't leveled up, or what you call it, that Goku when it level up and stuff, and then it turned into just water, you don't even get a couple little turds going bloop bloop, you know, and so you just got water coming out like you're peeing and stuff. Yeah, that's a problem. It's a problem. Yeah, and stuff. So when I'm saying that, just remember that. All jokes aside and stuff, yeah, that's cold. And dehydration I'm gonna tell you this and stuff. I don't know if anybody's ever experienced this, but the biggest dehydration hack that I know of is to know that you do have dehydration is when your lips stick to your teeth and you be talking and stuff and it stick to your teeth and stuff like that. It's like, oh, excuse me, I don't feel like talking right now and stuff. That dry throat, your throat ain't supposed to feel like sandpaper. It's supposed to be nice and mucoid and and stuff, and have its nice normal rhythm to it and stuff like that. So that's a problem. You can't even cry and produce a tear. That's a problem. It starts affecting your gums. Your teeth could start falling out one by one. Remember, and stuff. And it ain't for just meth mouth and stuff. I smoke that and stuff. Yeah, you lose your gums and the mucoid of your gums. So it's a whole bunch of goodies, and stuff. Cause they're laughing at me. I'm just saying, and them teeth stick like, ooh, be like, what the heck? But anyway, Rosie said, all right, now say it. And dry skin. When you rusty and crusty on them knees, like what's his name? Mr. Brown, so he'd be wearing them shorts and had a little crusty elbows and crusty knees and stuff. They be like powder and ashen. That's not enough. Your skin needs moisture too. That's why they invented lotion. Now, most of the lotions aren't no good and stuff, but if you get the right lotions and stuff like that, they can really help your skin out. Your skin is supposed to be shiny and supple. It's supposed to be, it's supposed to have a lot of good, it's supposed to feel good. It's supposed to be soft and not brittle and crunchy and stuff. Now, I have nurses' hands, so we wash our hands so much that we start getting rashes on our hands and stop being able to wear the gloves with the powder in there because we put them on and then, I forgot something. So I pull the gloves off, wash my hands, and then run out and do that. And then come back in, wash my hands, and then put some gloves back on and all of that stuff. It caused a lot of trouble. Auntie Josie had one. Cousin Maria said that the skin is the biggest organ. That's right, because guess what it covers? Head to toe. And you know that your fingernails and all of that stuff is a part of skin. Your hair that grows out the face for the men. Then some women, we get a little mustache sometimes too, get a couple little hairs and stuff like that. But all of that, that's all a part of the skin. The skin covers your eyeballs. If you don't have an eyelid to cover your eyeballs, what do? They're going to dry out and die on you, and stuff. So that's a problem. And everything. Auntie Josie said something. I've been eating Wheaties and wheat checks because it has fiber and it really helps me to go to poop, and stuff like that. That's a big deal and stuff. Eating those, when they say fiber and stuff, just make sure that we're reading. I'm gonna bring back up another live on reading those nutrition things so you'll know that don't be fooled because it say 250. It might say 250 for 3 crackers and stuff. And then it got 15 crackers in there. So 250, 250, 250, 250, 250. Okay. So that's where that comes in at. Welcome on in, Miss Madeline. I miss you. Yes, she said, I'm late, but I'm here. Thank you so much. I'm glad you could be here. And then also anything you missed so far and stuff, you could go back and watch the replay and stuff, but you won't get me live and everything, but it's okay and stuff. Thank you for coming in. And, Rosie Granny Allen said, me too. She got her Wheaties. She got some Rice Krispies. And what else she got? Raisin Bran. No, I'm just playing. Raisin Bran. It's delicious, I guess. Madeline said, LOL. And she said, miss me too. Oh, we miss you and stuff. You got to come visit us. We done moved. After 86 years in the same house, we done finally moved and stuff. And I'm happy. And then, but anyway, yes, and stuff. So, like I said, all these different ones and stuff. And you guys go back and watch the replay and then watch what I put as the answers to some of the questions or some of the information and stuff, because it'd be good stuff that you could take and stuff. It's not just us. Guess who else need fiber and hydration? These baby kids. How can they keep on acting up and acting a fool and stuff with us and be bad as hell? I mean, bad as heck. But how can they do that if they, if they don't have their, they get diarrhea, they get constipated, and I can't boo, and all of that stuff. Like, they can't do it either. It's up to us to fix them. Even if you don't fix you, fix them then, and stuff like that. But saying all of that, Madeline said, yes, yes, yes. Right, and stuff. We all need it and stuff. Guess what it affects? It affects our hair. It affects our eyes. It affects our skin and cause it to be saggy instead of, like you pinch it and it pop back. After a while and stuff, I get a couple more years on me and stuff, I'm gonna pinch it and it's gonna stay there like a little happy face or stuff, because you got to take care of your skin. You got to take care of your teeth and stuff. It's a big deal and stuff. Rosie Granny Allen said, well said, thank you, Mom, and stuff. Yeah, she got to take care of it and stuff. So just moving on, constipation. It's the difficulty passing stools or infrequent bowel movements. That means you don't even, a normal bowel movement should be about 2 to 3 times a day and stuff every day. Of course, nobody is doing that and stuff like that. Some people are, and stuff. You're lucky, but it's few and far between and stuff, because I don't even go 2 or 3 times every single day and stuff. Flowers come out. No, I'm just playing and stuff. But I'm just saying, you need to have a regular rhythm, and when you don't, you gonna feel that. As many a times I done felt it and stuff and been like, oh my God, you get all gassed up and all this weird stuff happening and stuff. Yeah, it's cold. It's cold. But the causes, you don't have enough fiber for constipation. Now, you guys, you don't have enough fiber, dehydration, lack of exercise. Y'all know y'all got to exercise. Me too. Yep. Do I know I got to exercise? Yeah, I know. Do I? Not all the time, but yeah, I'm it's waking me up. Okay. Because I'm far from perfect and stuff. So then we got certain medications cause constipation. I told you them drugs like, Norcos and all of that. Yeah, they might help with this or help with that and stuff, pain, and they stop you up. It's called OIC, opioid induced constipation. See, y'all got a new word. But anyway, and then ignoring your urge to go. You got a dookie, but you sitting on the bus or something, squeezing your cheeks. Like, please don't come out on this bus in my pants, and stuff. Yeah, that's a problem. You might have to get off and miss that bus and go to that gas station if they let you in, and stuff, or keep on begging until you make it to somewhere you got to push that out no matter where. And I was the type that, this ain't got nothing to do with nursing and stuff. I was the type that didn't like to go to the bathroom in strange places. It went back up inside of me because, yeah, it probably did and stuff. And guess what? I end up with kidney injury, acute kidney. So that's a sudden kidney problem and stuff because I didn't go when I was supposed to. I wiggled. I got to still chart. I got to chart that I'm getting out of here at my time. I'm not staying here with y'all, and stuff. Nope. And I'm charting and stuff and holding that pee. And then after a while, I don't have to pee anymore. Where did it go? That's the trash of your kidneys. Where did it go? Exactly. It was to make up an infection for me and stuff and cause me to have other problems and stuff until I fixed it. Now, I bet you I wouldn't do that now and stuff. But, also, Maria said prune juice is good. Yep. And I heard that tastes real delicious, huh, Maria? You gotta tell us a way to turn that around and stuff because, whoo. No, I know definitely that it's good to help you and stuff. But I'm like, yeah, give me a recipe. because it can't be just prune juice and stuff. Because it's like a big dirty raisin or something like that, and I hate raisins and stuff, so I'm already in trouble. In a lot of trouble and stuff. But I'm saying, that is a natural way and stuff. And I used to wonder why the older women, my patients and stuff, they would be like, can you order me some prune juice from the cafeteria? And I'll be like, oh, okay, yeah, you could get some prune juice. And then they asked me to put it in the cup and warm it up, nuke it a little bit like it was hot, warm tea. And that was a time when I had a little GERD. I threw up in my mouth just looking at the sight of it. And that's because guess what? I'm a nurse, but I'm human. I sometimes know what to do or to do good, and I might do bad, and stuff like not drinking that and stuff. But that's an excellent way of helping your constipation. A little bit of prune juice ain't hurt nobody. And then the other treatments for constipation, get your hydration on. Water up, fiber, exercise, and then if all hell breaks loose, stool softeners like Colace or Docolax or X-Lax or something. You got to get it out, and stuff, especially if it's a problem and it's going to turn into a blockage. Because guess what? A whole bunch of heart dookie that don't come out is going to sit wherever the heck it's sitting, blocking all the other dookie and stuff. And some might slide around it, but some may not and everything. Okay. I'm sorry, Rena. I'm gonna find out what that is and stuff, and I'll let you know and stuff. I got somebody that was trying to get on and it's not letting her and stuff. I'll figure it out and get you on and stuff. But you can always watch the replay and stuff. But also, I'm gonna find out and stuff. So I'll be calling you. Okay. So then, like I said, the stool softeners. When this is your body is a snitch quote. When the pipes back up, your body lets you know quickly by giving you gas, cramping, sweats, doubled over. It won't let you eat no more because you're so constipated that you ain't let the other dookie pass through. It's this one little player hating dookie that's just sitting there dried up in there and stuff because it ain't got no fiber. It ain't got no fluid or nothing like that. So it's just sitting in there trying to make a little cement barrier so that all the other dookie can't come out. So next thing you know, you're throwing up because it got to come out one way or another. And if you all backed up and stuff, it's going to find another way to get back to you. But you're going to pay for it. Not nobody else but you and stuff. So that's where that comes in at and stuff. Then there's diarrhea and stuff. And diarrhea is loose or watery stools occurring frequently. That means you run it as soon as you lay back down and stuff, you got a dookie again and stuff. You run in there like a little faucet and stuff from your butt. Not from the front, and stuff, the parts and stuff. And then you go back to lay down and stuff. And so are you touching with the tissue? It trigger a little more and stuff. It'd be like, yeah, I'm coming out some more. Yeah. I'm gonna let you know what's going on. You know what's up and stuff. But cousin Tony said, yeah, when that ass shut down, you in trouble. That's why it's important to have fiber and water as a part of your diet. Absolutely. And guess what I found out? Soda don't count. Juice don't count. Have you seen, even the labels on the fruit juice and stuff? I'm getting me some grape juice cocktail or some ocean spray cranberry and grape and all of that stuff. Did you see what was in it? It's a whole bunch of things before it gets to the part where it's like cranberry and all of that. Have you ever looked at the percentage? If it says 100%, you could probably depend on it being 100%. They can't lie. They'll get sued and everything and stuff. So if it don't say 100%, you getting what you get. You getting a whole bunch of trash that you putting down in there thinking that my belly is full with all this Kool-Aid and yeah. It ain't no nutrition in that and stuff. You might get a little bit of fluid out of it, but it's very little. Anything once the sugar hits in there, that real sugar, even the fake sugar is still bad and stuff, but that real sugar hit in there and stuff, you got a problem. So just remember that it's not healthy. You just like it for the taste, because that's what they're doing. They're fixing it up. Because if you had 100% real cranberry juice, it tastes like poison. 100% real grape juice, it tastes like poison. 100% real apple juice, not 100, even apple juice and stuff. I take that back. Apple juice, it tastes like apple juice and stuff. It's pretty good and stuff. But it's a whole bunch of those that you looking at and stuff. Dragon fruit, they're giving you a dragon fruit flavor, and they playing with your stuff, and they in there mixing stuff up like they mix dope up, and stuff. And then they serve you, here go crack-a-lack-a-lacka instead of crack. I just want a hubba. No, it's crack and something else. I put some Drano in there so you could die faster and I could lose my little customers. Or I don't know why I went off on that tangent, but I'm just saying we can't depend on everything they say on the label and stuff, because they are doing us a disservice. We could just try to go for the healthiest stuff, and it's usually the higher price stuff and everything. Yes, Cousin Tony said the cherry juice is good. It's tart, but it's good too and stuff. Yes, if you get pure juices, you'll be able to taste them. A lot of people, a lot of companies are making them, like the Odwalla drinks and the super greens and stuff like that. They're actually trying to do that because they know that the people that want to be healthy are going for theirs. So they're going to make sure that they get theirs leveled out just right. But even they fail sometimes because you keep it so clean that it's easy to mold up. It's easy to spoil and stuff like that. It costs $1 million instead of that cheap little, I sure like that Sunny Delight. It give me all my vitamin C's. Oh, because it tastes like orange. Look at it and look at the label and stuff and find out. But I'm saying all that to say that, yeah, this is really a part of our lives and everything. So like I said, diarrhea and causes of diarrhea is infections, food poisoning. Yeah, they're not cooking your stuff right. All good trucks and food trucks and stuff aren't good trucks. You just don't know. What house was they prepared in? Did they clean and bleach off the countertops and stuff? Do you clean and bleach off your own countertops and everything and stuff? Viruses, antibiotics, and stress causes diarrhea. Yeah, they even scared the shizzle out of me and stuff. Yeah, that means you just went, and stuff. Yeah, they gave you bubble guts, huh? Cramping, dehydration, and weakness are some of the big things of diarrhea, because you just keep cramping. It's like it's just ringing your bell, and stuff like that. It's terrible and stuff. And then treatments for it: fluids, electrolytes, rest, and treat the underlying cause. You got to find out, was it food poisoning? Was it something else? Was it my antibiotics that I took for something else? And now I got diarrhea from it, and stuff like that. It doesn't sit good on my stomach, and everything. So then danger signs of anything stooling, and stuff like that is blood in the stool. That means it didn't went past inflammation. Now it's bleeding. It's in trouble. It's waving a flag. Hey, you got to get something. You got to call 911, and stuff like that. Fever. We're not supposed to have fevers. We could be hot because the sun is hot outside, but we're not supposed to have fevers, and stuff like that. Also, severe dehydration. Severe dehydration, them lips are stuck and stuff. Your tongue, you can't even make slob. You can't even spit, and stuff like that. There's nothing there. It's cold. You feel like you really in the desert, but you right at home, not drinking that water and stuff. So that's what happens and stuff. And any symptoms lasting over a couple days and stuff is a problem. This is 911 and everything. So The last one I want to do, I'm gonna tell you the other things of the gastrointestinal system that are a problem. Gallbladder and gallstones. And that's hard deposits that form in your gallbladder and stuff. And so that's one. And then I want to get to hepatitis. That's the inflammation of your liver. Your liver is your filter. This is what keeps you alive. And when you have liver disease or some type of liver problems and stuff, it's a problem. And this includes hepatitis A, hepatitis B. I just got the shot yesterday for hepatitis B because it's, for needles. We putting them needles in the sharps and one of them sticking out at me and I poke my finger. Not only do I get HIV or AIDS and stuff, but I actually get hepatitis. It's somebody else's blood. We didn't do no blood transfusion. I stuck my hand in there trying to push them down or something and then jab myself with somebody else's needle and somebody else's contaminants, and stuff. That's a problem. I have him. Thank you, Jesus. Thank you, Jesus. But anyway, that can happen and stuff. And the causes are virus, alcohol, drugs, and toxins. The symptoms is jaundice, yellowing of the skin, fatigue, dark urine. When they say dark urine, your urine's supposed to be lemon yellow and is Coca-Cola brown and stuff. That's dark urine. And is kind of thick, almost and stuff. It's a problem, period. Nausea and abdominal pain. And the treatment is antiviral medications to avoid alcohol, to rest and get vaccines, hepatitis A and hepatitis B vaccines for it and stuff. Then there's another one. I'm not going to go into it and stuff, but it's diverticulitis. And it means the inflammation of or infected pouches in the colon. The colon is your large intestine. That's where the dookie is formed at because it's getting ready to come on out of you. But it's a problem up in there and stuff. So it causes all types of inflammation, and the inflammation will cause your colon to bleed, which will cause you think it's hemorrhoids all the time. It's not always hemorrhoids. It's something else called diverticulitis, and that is a problem of your colon. It's inflamed. And so as that poop, it just catches on to one of them pouches and drags it and it bleeds and stuff. Next thing you know, you got blood and poop all at the same time coming out your butt and everything. So it's a problem. And this is for human beings. So it ain't just woman related or just man related. It's for human beings and everything. So then their treatment is antibiotics, clear liquids, and fiber after you heal. See how fiber just get fiber and stuff. And then one that was kind of near and dear to me and stuff, my dear mom and stuff, is common gastrointestinal cancers. There's colon cancer, there's stomach cancer, there's liver cancer, there's pancreatic cancer, and there's esophageal cancer. That's the whole digestive system. And it's cancers of every part of it. From the top to the bottom, yeah, that's a problem. Hello, hi, Michelle. Welcome on. If you missed anything, no worries and stuff. You can go back and watch the replay after I'm off live and stuff. I'm gonna go ahead and stay on until 30 minutes after, and then I'm done and stuff. But if anybody has to go, just make sure you come back and stuff because this is good stuff, and I want to make sure that you at least get something out of it and stuff. It's a very good live and stuff, and this is what we all go through because guess what? We all got a gut and a butt and stuff. So this is us. And so I just said the common gastrointestinal cancers, and that will be your colon cancer, stomach cancer, liver cancer, pancreatic cancer, and esophageal cancer. The warning signs will be blood in the stool, unexplained weight loss, persistent stomach pain, trouble swallowing, and fatigue. Your risk factors for having these cancers, any one of them, it doesn't matter which one. Your body will pick which one they want to pick and everything. It would be smoking, alcohol, a poor diet. A poor diet does mean 95% Cheetos and what is it, 5% soda and stuff like that. Yeah, that would be a problem. And then family history, somebody in your family that had it. So you ought to already be ready to find out, just in case. And obesity. What? Because I'm big. I'm healthy. Yeah, no, you're not. And even if you little, you're not healthy and stuff. You got to be right in between, or trying to work towards at least in between and stuff. No, nobody needs to be perfect and stuff, but try to be in between. And if you can't, work on it. If you get too big, work on getting littler. If you get too little, work on getting a little bit bigger, so that you right in the middle. There's nothing wrong with that. We human and stuff. We trying. Hey, Pastor Carol, welcome on in. She said, hey, Nurse Charlene. Oh, Nurse Allen. Thank you. Thank you for coming on and stuff. So I said prevention of GI cancers. I told you colon, stomach, liver, pancreatic, and esophageal will be a colonoscopy. Ooh, that's when they put that little tube up in your butt and they just blow water up in there or something. No, that's what is that, colonic or something like that, where you go to a spa and get that done. I bet you that's a hot mess. But anyway and stuff, it's when the doctor going up in there because he trying to make sure everything is kosher. And if it's not, he gonna tell you right then and there. And he gonna test it if he sees something weird and stuff like that. And we need to go have it done. And we don't get it done and stuff like that. And then we mess around and find out. So it's got to be a lot of praying, and then a lot of going to the doctor and going ahead and doing what's right for yourself and your family, so they don't lose you and stuff. Okay. And so common GI symptoms people ignore, or warning signs. Frequent gastrointestinal symptoms people should not ignore. And that would be blood in the stool, severe abdominal pain, persistent vomiting, unexplained weight loss, chronic heartburn, constipation lasting, persistent diarrhea, and difficulty swallowing. Any of those are a problem. Yes, Pastor Carol. Oh my God, she said, OMG and stuff. And yes, these are real deal and stuff. So sometimes we make a joke of it. Shoot, I didn't shit it out me some rocks, or something like that, and say, yeah, that's not good. You need to correct the rocks and stuff. They shouldn't be rocks. They didn't go in as rocks. Did you chew up rocks? Then they shouldn't come out rocks, and stuff. That means somewhere along the line, you didn't get enough of most likely fluid. It's really that bad, and stuff like that. You should never poop out rocks or poop out water. Sound like the shower on, but it's coming out your butt. Yeah, that's a problem. And you better hope it ain't no blood and stuff, or you really got a problem. It's waving the alarm. It's gonna get you and stuff like that. What else did I want to go to? I'm gonna go ahead and end it with my take-home message and everything. But I think I gave y'all enough of something to fight for, and stuff like that and stuff. I do want to do when to seek medical help and stuff, and then when to seek medical help. This is an emergency if you have severe abdominal pain. It's not supposed to be there. That's a problem. Let me see. Pastor Carol said, will your bowels smell really bad too? Absolutely. And also it depends on what you put in and stuff. If you had a nice rich food and stuff, it go in rich and smelling good and tasting good, and it come out and it got a special smell to it and stuff. No thanks to us, but it definitely, if it's real rough and stuff, that means it didn't sat in there too long and stuff. So it's fermented. That means like it's passes expiration. It need to come out of you, and stuff. Anybody, me, you, anybody and stuff. So yes, that's a big deal and stuff. So I said severe abdominal pain is a problem. Vomiting blood is a problem. Black tarry stools, thick, like kind of creamy, like what is that stuff that they put on roofs? That tar and stuff like that, black tar and stuff like that, your poop looking like that, that's a problem. It's sticking to the bowl, the toilet bowl and stuff. That's a problem. I got to get this out, you guys, and stuff. Hopefully y'all can stay here with me and stuff, but this is big. Severe dehydration and stuff. That means you haven't had no water, and you might have had a few sodas and stuff. Soda doesn't count as water. Even a little bit of water that's in there, it got enough poisons to dry that water up, so it don't even count. Even if you had a whole 2 liter, you only getting maybe 2 or 3 ounces of that is going to turn to the water you need. The rest is going to tear your body up and everything. Thank you, Ms. Nurse Mary said great information, and Pastor Carol said, okay, so important. These are definitely important and stuff. Inability to eat or drink, that's a problem. Why can't you eat or drink? It's a problem. So you got to find out what that is, because that means you're not getting no fiber in, but you're not getting no water or liquids in either. So that's a problem. Yes, you're right and stuff. Sudden swollen abdomen, that means your stomach just blowing up and nothing that you can't even dookie and get, flatten out a little bit. It should help you flatten out and stuff, but if you doing that and still going to the bathroom and your stomach is still super big, there's something else going on. You got to tell on it. It's snitching on you. Tell on it and stuff. And then the high fever with abdominal pain, that's a problem. That means a high fever that's over 101.0 and stuff. Anything over that, that's some trouble. You got to find out what that is. That Tylenol ain't gonna cure it and stuff. You got to find out what that is and stuff. So that's 911 worthy and stuff. So my take home message, you guys, and then I'm ending it after this, and it's not that long. Your gastrointestinal system affects nearly every part of your health. The gut helps fuel the body. The gut is the GI system. Fuel the body, protect the immune system. It protects your immunity, like vitamin C. I take vitamin C. Yeah, you can take 1,000. Your body only gonna keep 250 milligrams, and it's gone after 4 hours. I think 45 minutes and stuff. We did a live on this and stuff, so it don't even stay in your system. So you got to take about 25 times a day and stuff in order for the vitamin C in there, because you got a cold to even kick in on you. Okay, the gut helps fuel the body, protect the immune system, and remove waste. Many gastrointestinal or GI illnesses begin with mild symptoms that people ignore until the condition worsens. Okay, listen to your body early. Persistent pain matters. Changes in your bowels matter. I got diarrhea. I'm stopped up. I got diarrhea. That's too bipolar. That means your booty is playing bipolar, and stuff like that. It don't matter, man or woman. It's anybody with a butt and stuff, and a gut and stuff. Okay. Ongoing bloating, it does matter. Okay. Your body is a snitch, believe it, because the body usually gives warning signs before serious disease develops. So it's going to give you a chance, and it's going to give you another chance. Oh, okay. Come here and help me out. And then it's going to give you another chance. Oh, she still ain't listening. Oh, okay. I'm going to sit her down. She going to learn. She going to learn today. Ain't nothing going to help you and stuff, and until you go and see about it and stuff. God made the nurses and the doctors and all the specialists and all the lab people and everything and stuff. Why not? If you go definitely depend on God, go to him first. Like, God, don't let me be stupid so that I mess around and find out something even 10 times worse because I wasn't even paying attention to my temple that you gave me and blessed me with. Okay, so start with that and stuff. The gastrointestinal system, this is my conclusion. The gastrointestinal system is one of the body's most important systems. From mouth to the colon, every organ has a role in digestion, nourishment, immunity, and waste removal. Common GI illnesses such as GERD, ulcers, irritable bowel syndrome, hepatitis, constipation, diarrhea, and colon diseases can greatly affect the quality of life if left untreated. Okay. Understanding symptoms early, practicing healthy habits, reducing your stress, staying hydrated, real water, you guys, even me, because I didn't have my lipstick just recently to my teeth. Eating nutritious foods and seeking medical care when warning signs appear can help prevent serious complications. Remember, your gut speaks daily. The question is whether we listen. Wow. I had to get that out, y'all. And so, and I'm right on time. I said 30 minutes after and stuff. So as I conclude and stuff, y'all go back, like, tag, and share. You know, you might, even if you're not going through a gastrointestinal problem, guess what? Everybody around you, all your loved ones, they got gastrointestinal systems. So just because you dookie and just perfect and you peeing just perfect and all of that good stuff and everything, that don't mean everybody doing it. And guess what? Little babies got a little gastrointestinal system. That's what they use to fill up the diapers with all them little prizes for you and stuff. Little kids, kindergartners, first, second, third, fourth grade, teens. Okay, humans. Okay. So this is everybody and stuff. So when I'm saying this, I'm saying that this matters for everybody. So even if it's not you having a problem, now you got the information you need to make sure that you continue to not have a problem, but also to make sure that you can spot that, oh no, that's constipation. When the last time you drank some water, you know, and stuff, you could hit them up, you know, do that, hit them up and stuff and get them and stuff like that. But also the fact that, this is important. And I'm not coming on here for nothing, you know, and stuff. I take my time. I really research what I'm doing and stuff so that I never give you something bad. I always make sure I pray before I come on so that I'm delivering some good, honest stuff. I don't want to be on here playing games and stuff. If I'm going to use my social media and platform and my face and my comfort and all of this stuff and everything and stuff, I'm doing it as a treat, as a gift, the gift that keeps on giving. God bless me with enough knowledge to be a nurse for 22 years. A high school dropout, teen mom. Yes. Yeah. So when I say this, I'm saying that it's coming from the heart. And I'm glad for my family to come on and my close friends and my extended family and everything stuff. It's so important. If I have to arm my family, one family at a time, and my extended family and my best friends and all, you know, everybody and stuff, then so be it and stuff. But y'all gonna know what you need to know to be okay. And then you're going to be able to take that news and that message and take that on to the people around you and keep everybody safe and everything and stuff. And this is really, really important and stuff. And like I said, your body is a snitch, believe it. Let's get it started now and stuff. We started already and stuff, but I'm saying let's get this thing going and stuff because it's important. Our body is important. And there will never be another you or another me. Not just like me. They might look like me. They might look like you, but never be the same and stuff. So with that being said and stuff, y'all take care of yourselves and everything else. And let me just read a couple comments and everything, and then I'm out and stuff. And that is, Rosie said, great topic. Keep up the good work. I think she was saying and stuff. Yes. And then, Cousin Tony said, good job as always, cuz. Thank you. And thank you for coming on and stuff and choosing yourself. And then, yeah, you said good work and stuff. Oh, and then she said, much love, mommy and stuff. So I thank you guys and stuff. And I appreciate it. And everybody is on. And who I love is on, you know, and stuff. Definitely and stuff. Like my mother, you know, I'm very close. We have already still going through our healthcare journey and all of that stuff. And it's no joke. and at the same time, she was so unselfish that she let her nurse slash daughter slash caregiver get on here and break this stuff down for you guys and stuff, and let you know that it ain't no joke out there. And what happens is nobody doing what I'm, well, I don't know, doing exactly the way I'm doing it and stuff, breaking this stuff down, so that when you get yourself in that bad situation where, what am I supposed to do? My mama got this, or my dad got this, and and this and that and stuff, and and you feel alone almost and isolated, like you're the only one going through it, and you're not. It's a little bit of everybody and stuff. It might not touch you directly, but it's going to touch somebody you love or something like that. So that's why just getting on here and learning a little something. It's only, an hour, hour and a half tops. Sometimes, I might go over and stuff like that. But that's when I know that it's really important that somebody got to be listening and everything. And I say, with this and stuff, I'm just gonna keep on as long as God say it's okay and stuff, and I'm gonna keep on teaching and everything. And I thank you for respecting who I am and my abilities and everything. And being that I've been a nurse for 22 years, that's a long time. That's a couple decades and stuff. So it's long enough to know that I figured out a few things along the way and stuff, and yes, that's how we live and we learn and stuff. So thank you so much, you guys. God bless each and every one of you. All the people I said I'm praying for, I'm gonna just make sure that I do a group prayer over everybody that came on and everybody that will come on and check it out, and everything. Take care of you, because you never know. You could take care of your loved ones and you might just save somebody by accident and everything. So thank you guys, and thank you for all the participation, all the comments and everything and stuff. I love them all. Pastor Carol said yes. Thank you. Thank you. I'm humbled and everything. And y'all take care, and thank you for your time. Okay? All right, you guys.